All right, the Premier must reverse the unfair restriction of bonuses for nurses and healthcare workers off on medical leave following the reporting of Katie Doyle's story. Dozens of nurses on medical leave have come forward to share their experience of being excluded from the full $10,000 thank you bonus from the Houston government. Of course, we had Katie on the show yesterday. Joining us for a chat about this is Claudia Chender, NDP leader, and this release that I just read is from the NDP. Claudia Chender, thanks for joining the show.
Thanks for having me, Todd.
All right. So listen, this is one of these things that I think that there could be blind spots when you roll something like this out. I think that's okay if that's the case, but then what do you do about fixing the blind spots? They did that with maternity leave nurses, but this is another one that they need to right this wrong, in my opinion, and obviously you share that opinion.
Yeah, absolutely. I mean, I think this program was rushed, and I think the sentiment behind it that we want to thank the nurses that have remained, as many have left over the last few years, which have been incredibly trying at the front line of our healthcare system, is good. I think most people agree with that, but it's really clear that it was not properly thought out and it was not properly implemented. And there are a whole bunch of people who are upset about it. As the Premier has said, there will always, we have to draw a line, and there will always be people who are on the other side of that line. But in this case, we're talking about full-time employees who, through no fault of their own, are, undergoing some significant health challenges at a time when we have a health crisis, right? Mm-hmm. And so it just doesn't, as you say, make any sense to most people why this is where that line would be drawn. I have to imagine it doesn't make those healthcare workers, and we, ourselves have heard from dozens, so there are many, probably feel that, well inclined towards the government or excited to return to work. We know nurses have options right now, and our number one priority needs to be retaining them. And, I think, as you say, this was a mistake. And it's one that the government certainly has within its power to remedy, and we're really calling on them to do that as soon as possible.
Have you heard any response at all from your counterparts on the other side?
Well, yesterday the Premier was asked directly about this at the Nova Scotia Nurses Union meeting, and, he certainly didn't indicate that he was in a position to change it. He said the line had to be drawn somewhere, and then he encouraged people to reach out to their employer. Now, of course, all the nurses we've spoken to have done that. And what they've discovered is that they're not eligible for the full bonus. So, again, yes, the line needs to be drawn somewhere, but, this is a government and a Premier who have repeatedly said that money is no object when it comes to healthcare. We've seen millions and billions, in fact, dollars of spending on healthcare, and, lots for things that are really important and that we understand that we need. And then, some for things where it's not quite clear what it's going to get us, or when that benefit is going to be delivered. Here is a situation in a crisis environment where you could make a real difference in people's lives at a time when inflation is hitting everyone. And, it really feels like the government's choosing not to do that. So we'll continue to press.
All right. So on the subject of health care, the Tim Houston, as you alluded to yesterday, he was joined nurses. Nurses were having their I believe it was I don't know if it was their annual meeting or what it was here, but they were meeting, and the Premier paid a visit and told them that look, he said we are moving the needle, I think is how he described it. Do you think that they've moved the needle in some way?
Well, that's what they keep saying. They keep telling everyone that things are getting better, but I have yet to hear that from anyone on the inside or trying to access the healthcare system. So we know that there are more and more and more Nova Scotians each month that continue to lack access to primary care. We know that the waiting rooms, the wait times in emergency rooms continue to be incredibly long if your emergency room is open. So in lots of parts of this province, you cannot at all be guaranteed that you can even access your local emergency room. So, the short answer, Todd, is no. I mean, we haven't seen that. I think, we certainly, there's an announcement today about more pharmacies, I think, offering clinics so people can, get antibiotics for strep throat if they need them, or, get some, sort of basic ailments dealt with. So there is an effort to improve access to basic primary care, but that access is not a replacement to people really having a family health team. So it's great if you can get diagnosed for strep throat, but if you're concerned that you might have cancer, or if you need a hip replacement, or if you need a referral to a specialist, that's not going to help you, right? Like there's not someone who's actually following your health care. And we have a province full of people who tend to be older and tend to be sicker. That's just the reality of our demographics. So, we want that needle to move. We've said from the very beginning, when this government was elected with a promise to fix healthcare, like, we will give you all the ideas we have and, take them and run with them. And in lots of ways, we are looking for that movement. We are looking for that improvement. But so far we haven't seen it.
All right, it was at the Nova Scotia Nurses Union annual convention in Truro yesterday, or when the Premier was chatting with nurses, and he said, "We're committed to fixing healthcare." I'm reading this quote from the Chronicle Herald. "We're committed to fixing healthcare in this province, and when I can interact directly with healthcare professionals, I always learn something from them, and we're committed to fixing healthcare in the province." So, do you agree with that he's always listening and learning and applying what he's learning?
Well, we know, that the nurses who are excluded from this program have reached out to the Premier on several occasions, many of them. Most of them have not gotten a response at all. So he might be listening to some people. But if that's accurate, if that's the approach that he's taking, then here is a great opportunity for him to show that that's real. He is hearing from healthcare workers on the front line that they were unfairly excluded from a program meant to thank them and hopefully to retain their services, and telling him that that's unfair and that it's impacting their lives. And so if he's listening, he will reverse course.
Yeah, absolutely. Because it just seems like this massive hole that we're trying to dig ourselves out of, and it's again moving the needle. How do you even measure that? If you're going to say we're moving the needle, I think that you need some empirical data at some point to back that up, right? And has there been any presented, in fairness, that you've heard from the Premier, empirical data that would back up that claim that they're moving the needle in the right direction?
Well, we're seeing new data, right? So back to the example of primary care, what we've been talking about for years now is the number of people who are not attached to a primary care office or a doctor's office. Now, what the Premier is telling us is that's actually not the data you should be paying attention to. What matters is the number of people going to walk-in clinics and accessing virtual care. So I think they're, creating new data sets that they feel like support their argument. But this, again, does not reflect the reality of the people that we speak to who tell us that they continue to have challenges accessing primary care. They continue to experience incredibly long wait times for surgeries, and they continue to have emergency rooms closed in their communities. So, we haven't seen it, Todd. Systemic change is hard, and it doesn't happen overnight. I acknowledge that. And so again, we welcome a focus on healthcare. It needs it. But for people that I talk to, I'm guessing for people that you talk to, we're not hearing almost 2 years in that it's getting any better.
All right. When it comes to scope of practice, this is something that the cabinet can now have a lot more control over. From I'm going off memory now, But there was concern about scope of practice and cabinet having say over that without having to deal with the with the individual colleges. Is this something that have they employed this yet, to your knowledge?
Yeah, well, listen, it's not just scope of practice, it's actually ability to practice at all.
Right.
And so we saw in the last session that the government's signature healthcare bill essentially took the main job of the 22 healthcare regulators in this province, because we have 22 separate regulators who all also have a kind of umbrella group, and their main job is to protect the public. And the way that they protect the public is to ensure that the healthcare professionals who are practicing in this province are fit to practice. That's really their main job. And for some reason that I cannot understand, this government decided they're going to be better at it. And so in this legislation, they took that power for themselves over the objections of every single one of those 22 regulated professions, the experts who are in the position to understand whether or not someone is able to practice. Now, the explanation we heard was cutting red tape. But again, every single one of those registrars said, we want to cut the red tape. We want it to happen faster. We will work with you. We will be willing partners. But we know what we're talking about, and you don't. So I think that was a very, very scary move, personally. To my knowledge, no, it has not been employed yet. The bill just passed, not just a few weeks ago. And I'm hopeful that they'll never use that provision because it's extremely dangerous. There's lots of reasons why, someone licensed to practice in one jurisdiction may not be fit to practice, maybe without a little extra training or whatever is needed in ours. Yes, we need to, slow down the timelines. But, for doctors, for instance, the College of Physicians and Surgeons are recognized as leaders in our country about this. They have done so much to make that process smoother and faster and better for doctors, and they continue to do that work. Instead of supporting them or consulting with them or seemingly consulting with any professionals, the government decided they'd be better at it. And I don't know about you, but, I think we trust Executive Council to do a lot of things. Understand the intricacies of when and how a physician or a nurse or a nurse practitioner can practice is not one of them. They're not trained for it.
Claudia, thanks so much. Appreciate your time as always.
Thank you.
All right, take care. Claudia Chender, NDP leader.